NBC5 News at 5 starts now.
Asante Rogue Regional Medical Center employees meeting with leadership today in a pair of employee town halls. Thanks for choosing NBC5 News at 5. I'm Craig Smolin. Asante held 2 town halls today to cover topics including culture of safety, primary care access, and a financial update. What it didn't spend much time on was the ongoing police investigation at RRMC that NBC5 News broke last week. That's our top story tonight at 5. Multiple Asante sources who don't want to be named tell us as many as 8 or 9 Rogue Regional Medical Center patients died as a result of drug diversion. Our sources say a nurse in the intensive care unit replaced fentanyl medication used for pain with tap water. They say the tap water, which is not sterile, led to multiple infections. Though Medford police began investigating the situation in early December, no one has been arrested yet. A source inside the Smolin Education Center at RRMC today said at one of the town halls an employee asked Asante leadership about the investigation and why they were hearing about it from other people and not Asante itself. Employees were told the health system was dealing with it legally. End of story. We told you Tuesday Asante's own website had news articles about infection-related issues at RRMC. It's taken those articles down. A 2023 article written by the former Asante VP of Quality and Patient Safety, Holly Nickerson, said the hospital was seeing central line infections from leaving IVs in too long. Another article by Nickerson from December of 22 said several central line infections in Asante critical care units were linked to waterborne bacteria. And now we're learning federal government data also shows Asante Rogue Regional Medical Center faring worse than the national averages in both sepsis care and bloodstream infections in ICUs. Sepsis occurs when your body has an extreme response to an infection, damaging organs. It can be life-threatening. Data from Medicare.gov shows 24% of 173 RRMC patients received appropriate care for severe sepsis and/or septic shock. That's less than half the national and Oregon averages of 59% and 55% respectively, according to Medicare. The data is based on a sample of cases and patients. Healthcare-associated infections, or HAIs, are infections that people get while they're getting treatment for another condition in a healthcare setting. RRMC's data on Medicare.gov shows central line associated bloodstream infections in ICUs and select wards are worse than the national benchmark. In this case, lower numbers are better. The national benchmark is 1.0. Asante's number, 1.778. The host of our long-running Docs on Call program, Dr. Robin Miller, says the data has to make you wonder, given the nature of the current police investigation.
You wonder if they were asking questions about hospital-acquired infections at the time, and that's all you can wonder.
We reached out to Asante yesterday asking multiple questions related to this NBC5 News investigation and infections inside RRMC. Specifically, we want to know what is Asante's historical infection rate, how frequently that is looked at, and what protocols are in place to prevent infection. Asante declined to comment. Stay with NBC5 News for updates on this ongoing investigation.